Hello, in this video, I'm going to be answering the question, did I cause my breast cancer? This is a common question we get, whether it's asked directly that way or in a different way. Before I go on, I'd love to invite you to subscribe to our YouTube channel. We're always putting out new content, and if you subscribe, you'll get alerts that we have a new video. I'd also love to invite you to go to Yerba.com to get your personalized report. So a lot of people wonder, what is it in their history, their lifestyle, their family, exposures that they've had that might have caused their breast cancer? I need to start off with the fact that only 50% of people with breast cancer have even one risk factor. What that means is, out of two people, only one of them can we say this may have contributed to your breast cancer. In other words, you can be a marathoner, a vegetarian, never smoke, never drink, use sunscreen, not be exposed to radiation therapy, eat healthy, have no family history, and still get breast cancer. It's very troubling. And I think a lot of science and medicine is focused on these are risk factors. Here's a new risk factor. If you have your first child at a certain age, after a certain age, or if you don't have children, you're at higher risk. If you take this medication or you did this, you have a higher risk. That's because what we're looking for are things that can be prevented, things that we can, especially in the environment, decrease exposure to. Also, there's a sense of, it's really interesting, especially in America, if I know what caused it, I won't feel so powerless. I can attribute my breast cancer to a decision I made when I was in college. Now the world makes sense. We don't like the world not making sense, and we'd rather grasp onto something that explains something random than have it be truly random. So I hope that makes sense. I think we'd also rather feel guilty, I did this and got breast cancer, than out of control. I think, again, it's that randomness. The other reason people like to know, did I cause my breast cancer, is because they want to know that they have control over the breast cancer and maybe they can keep it from coming back if they make a change. If I do this, can I make sure it doesn't come back? And we totally understand that impulse and the way of making meaning and getting some sense of agency. I also think it's really harmful to tell somebody you got breast cancer because you did this, because 100% of people who did that certain behavior will not get breast cancer. So it's a combination of multiple things. It's a combination of the genes we were born with, the exposures in our family, maybe even before we were a fetus, like chronic stress of being a minoritized person or living with violence or trauma, even in generations before us, may be related to the development, not of cancer necessarily, but of particular types of cancer. How could you have controlled that? How could you have controlled what happened to your parents or grandparents? We also know that there are certain genes that account for 5 to 10% of breast cancers, and one certainly cannot control that. We can't control who our parents are, and we can't control who our kids are. So this is a place where blame and causation can be really unlinked from some sort of witting behavior. There are some things that we inherit and that may also be due to environment, like the age at which we menstruate can be due not just to our family history, but other things we're exposed to. We know that the onset of menses is becoming, in the US at least, younger and younger, and that may be due to nutrition. It may be due to environmental hormones, like in some hair products and products used for straightening hair in some people. And we need to say that a lot of those products are used so that people can fit in and be treated equally. So a lot of the exposures we have are in environment and maybe in products that we're exposed to without knowing that those things are there. The other factors that play a role are other exposures. So some people might have radiation therapy for one cancer, and that can increase their risk for breast cancer. And many decades ago, people were given radiation therapy for something like acne on their back, and that was associated with that therapeutic exposure to radiation therapy was also associated with a higher risk of breast cancer. And certainly in those days, especially if one was young, you didn't make a choice whether to have that or not, and close surveillance is warranted. And certainly we know in people who've had other cancers that being followed up long term is really important for detecting cancers early. Diagnosed with breast cancer? Meet Yerba, your guide to personalized treatment options. Each option is specifically tailored to the unique characteristics of your tumor. Sign up today at yerba.com to take control of your breast cancer journey. What about your diet? Is it possible that your diet contributed to your breast cancer? It's really interesting. We have a lot of videos on, are these foods safe for people after breast cancer? And as I mentioned at the top of this video, there are many people who followed a plant-based diet, never drank alcohol, and limited their intake of fat who developed breast cancer. So there's actually no diet that can prevent breast cancer. We have no proof that a particular diet can prevent breast cancer. The reason I said that twice is it's really important. We all eat the foods available to us when we're children, and that can depend on the neighborhood where we live, or cultural practices, or foods that are in our family's repertoire. You know, I ate a lot of chicken casserole when I was a kid, and the things we get in our diet are not determined by us necessarily. Different economic opportunities are associated with our diet, or availability of healthy foods in our neighborhood. So while a healthy diet contributes to many health conditions, heart disease, obesity, other factors play a role, like minority stress, like other things in our environment that may combine with our genetics to increase our risk of breast cancer. But it is not the case that your diet gave you breast cancer. And again, there's no diet that can prevent breast cancer alone. Certainly diet and exercise can contribute to our overall well-being. And there are reasons to think that exercise, by decreasing inflammation, could decrease the risk of cancer or cancer recurrence. But exercise is not just due to one individual person's behavior. If you're working 2 jobs to make ends meet, you do not have time to go to a gym. If you're in a neighborhood that doesn't have access to healthy places to play, you can't get the exercise that you might hear is recommended by the American Heart Association. So no, you did not cause your breast cancer. What about alcohol? What about smoking? You know, we know some of these things, especially alcohol, is linked to a higher likelihood of getting breast cancer, but many people who drink to excess do not get breast cancer, and many people who've never had a drink do. So yes, we do recommend that you avoid alcohol, and there's more and more evidence that alcohol is actually not safe in any amount. So as a healthcare channel, we're going to say it's not good to drink, but if you have in the past, or if you currently are, you're doing your best. There are lots of reasons that people will drink alcohol. And it's important to know that that alone did not cause your breast cancer. And if you are living with a recurrence of your breast cancer, you did not cause that. If you take one thing away from this, is that you did not cause your cancer, no matter the lifestyle you've had, what you've eaten, your economic opportunity. We're always trying to make the environment and the world safer, but you alone did not cause your breast cancer. I hope this has been helpful. Drop a comment or a question below. We love hearing from you. We try to get back to you within a week or two. We always want to say thank you for watching, and we'll see you next time.